Today's tip is about the importance of establishing clear goals when making medical decisions for your loved one with dementia. Hi, it's me, Linda Burhans, the gal who cares for the caregivers with love, laughter, and lessons learned. This week we have Dr. Brittany Lamb, and she's going to talk about some of those decisions.
Hey there, I'm Dr. Brittany Lamb. I'm an emergency medicine physician, and outside of the emergency department, I help families of people living with dementia anticipate and plan and learn about the medical decisions they are likely to face so that they can have a plan to fall back on how they're going to make these decisions. Today, I want to talk with you about 5 big decisions that I see medical decision makers for people living with dementia kind of struggling with and asking a lot of questions about. I'm not going to dive deep into how to figure out whether or not you would want to do these things in different circumstances. I do want you to know that in my practice and what I advocate for people is to create individualized decision plans, which can help you figure out whether or not you would do these things for your person. But these are really 5 big decisions I see people kind of struggling with that you should probably be aware of. And if you haven't faced this type of decision yet, it's something that you might face and that I would advocate that you start thinking about and having a plan for. So the first one is really, what are we going to do about the preventative type care and screening studies that people have routinely? So the big 2 to think about are for females, mammograms, and then for everybody, colonoscopies. Okay, so whether or not to continue to do preventative type studies with these screenings for cancer, and other things that would fall into these categories that your primary care doctors would help you with. So preventative type screening studies, that's something that you would want to think about and talk to your person's care team about. The second big thing is whether or not to have elective surgeries. So what do I mean when I say an elective surgery? I mean that surgery is not emergent, right? You're not coming into the emergency department and your person needing to have their appendix or their gallbladder taken out or have something done all of a sudden. So this is something that we knew was an issue and we decided to schedule an operation to try to fix it. And whenever we're making these types of decisions, it's always, any medical decision, it's always weighing out the risk and benefits of it. And so some of the most common surgeries that I hear about people kind of struggling over and trying to decide about, cataract surgeries are really, really big. And then different joint surgeries, so joint replacements, and those types of things. So that's something that you should know about and think about and kind of have a plan for your person. The third big thing that I see people struggling with is, what are they going to do if their person has a change in the way that they're behaving or their mental status? And if somebody has a change in them that seems very abrupt to you, so it's not something that you've noticed over the past weeks to months, it's something that you've noticed, today, yesterday, the past few hours, there's kind of a sudden change in your person. There is a process that you can use to kind of think through and troubleshoot what might be causing that change in your person. And a new medical issue is always something to consider. If you are interested in learning about the 6 things that I recommend that you kind of think through if your person has a change in mental status, I want you to go over to my blog. It's blammd.com/blog, and just scroll back in time and find the article about the 2 main reasons that people go to the emergency department people living with dementia go to the emergency department. Look at that article. The second most common reason people come to the ER is a change in mental status. And I lay out these 6 things that you can think through. But if your person is having a new medical issue, how are you going to handle that? What are we going to do? It all goes back to your person's goals of care. Okay, so how are we going to navigate when and if your person has a change in their mental status? This is almost certainly going to happen to your person. It's a when, not an if situation. So you want to kind of have a plan for that. And your person's goals of care and understanding what kind of care they would be okay with and not okay with is something that you can plan for, you can think about ahead of time, and you really should do that work, okay? So that's the third thing that I see people struggling with is kind of, what are we gonna do and how are we gonna take action if there is a change in the person? The fourth thing that kind of goes along in line with that is, let's say the person comes to the emergency department because of some new issue, okay? And maybe it's a change in mental status, or maybe there's something else going on. Maybe they're short of breath. Maybe they're having chest pain. Maybe they're vomiting. And they come to the emergency department and we find some new medical problem. or we're concerned about the risk of a new medical problem. And so staying in the hospital is offered to you and to your person. Deciding it ahead of time about when you would be okay with having your person stay in the hospital and when you wouldn't is something that you can plan for. And I want you to realize that, coming into the emergency department can be harmful to a person living with dementia, and so can staying in the hospital. It definitely is going to take them out of their routine, which you all know is super important. It will affect their sleep. Their medication schedule is not going to be like it normally is. They may not get the same medications that they normally get. The risk of delirium, which is a medical issue, is higher when people come and stay in the hospital, okay? And so there are potential harms. And so anytime we make decisions, it's all about risk versus benefit. And we really have to think about these things. And there are some situations where it would be super obvious and very helpful to your person to stay in the hospital. But then in other situations that you may decide that that's not what's in their best interest. And if you don't know about these things that we could be saying, hey, we want your person to stay in the hospital. If you learn about these things ahead of time, you'll be better able to navigate when you're asked to make these types of decisions. The last thing is that, when we make medical decisions on behalf of someone living with dementia, we do this for their entire life, their entire journey with this disease process, and considering what other medical problems they have, that journey as well. But oftentimes people will have a situation in which they are critically ill. Which critical illness is when someone needs care that can only really be provided in the hospital. If someone's critically ill, we would not be surprised if they passed away or if they had a permanent impact to their quality of life, a negative impact to their quality of life. We can determine in advance whether or not your person would want to have care that prolongs their life in certain situations, in different medical situations, based on your person's individual risk for these things. So there are certain conditions that everyone living with dementia is at risk for that can cause critical illness. Falls with injuries, infections that lead to sepsis, which is a severe infection that involves an inflammatory response in your body and can affect all of your organs. So there are big decisions that you can think about ahead of time and have a plan for. I believe that every person living with dementia should have an individualized medical decision plan that is tailored to them, so that you all, when you're making medical decisions on their behalf, will feel more confident and have peace of mind in making these choices. And that is what I teach online. I do this through my blog, through a Facebook group, and through an online course that I created. You can check out all of my services and how I help caregivers at blammd.com.
Thank you, Dr. Lamb. That was just fabulous. Tune in next week for another tip sponsored by Arden Courts, where all they do is memory care, and have a delicious day.